On your corner, in your corner. This is WJZ News at 5:30.
In tonight's Health Watch report, a college athlete, a torn ACL, and a surgery you may have never heard of. For some athletes, it could mean a faster, stronger return to the sports they love. The local student athlete I spoke to is proof. After a major knee injury nearly ended her season, now she's making a comeback that's turning heads. The rhythm of the track is familiar, but for Nora O'Malley, these laps are more than a warm-up. They're a test. Testing her speed, testing her confidence, and testing a knee that took months to rebuild.
It felt a little weird until like 8 months.
Roughly 11 months ago, Nora was sidelined by an ACL tear in her right knee, a devastating injury for any athlete.
I landed and felt a pop in my knee, so I knew something bad happened.
But doctors didn't just repair her ACL. They added something extra.
This is the lateral extraarticular Tenodesis, and this is on the outside of the knee.
A mouthful, but a big deal in the world of sports medicine. Here's how Dr. Mark Slabaugh says it works.
So you take a strip that's usually 8 centimeters long, and you put sutures in it. You take it and put it under the lateral collateral ligament, and then what you do is you put a screw or a staple right under that ligament and then sew it back to itself.
The LET procedure is performed alongside traditional ACL reconstruction, but is only recommended for young, high-level athletes in pivoting sports like track, football, or soccer.
Nora, she does the triple jump and then also the long jump. Those are her two specialties, and especially the triple jump. Those are the ones where, you know, you basically are running, you take one jump, then you take a second jump, and then a third jump, and you're doing it for distance.
A few months after surgery, Nora was cleared to run again. Soon after that, she was competing.
I got cleared to run 5 months after my surgery, which is a lot quicker than I expected to be, and I didn't expect to compete until like a year after, but I ended up competing in sprinting about 8 months after my surgery, which is a lot quicker than I thought.
And despite the complexity of the procedure, her recovery was surprisingly smooth.
I did not think I tore my ACL at all. It was not that painful. And especially after surgery too, I was expecting it to be really painful, but I could get up and like move around. The only thing that's different is that there's scars on one and no scars on the other.
Dr. Slabaugh says the combined procedure, the ACL repair plus LET, is growing in popularity among younger athletes.
When I started to do this about 2 years ago, it was probably only about 10%, but now it's almost 50% of the patients that I see that have ACL tears will do this particular procedure.
They've seen fewer graft failures and higher return to sport rates compared to ACL repairs alone. But it requires motivation and discipline.
If there's somebody that is not willing to do the work, then a lot of times we don't recommend the extra procedure.
Nora had both, and now she has her speed back too. From a major setback to a stronger comeback, for Nora, the finish line is just the beginning. Now, the LET procedure is recommended for certain athletes, typically younger, high-demand patients who play sports with lots of rotation like track, basketball, or soccer. It's not for every patient, like those with arthritis. Dr. Slabaugh says the combination approach could soon become the new standard for those at highest risk of re-injury.